Welcome to Journey to 600. We're back again talking about special tests, but our focus is on the ankle today. Again, we're going to break it up into ligaments, then looking at some nerve testing and just some other tests for the ankle. Starting off with the ligaments of the ankle, we're going to be talking about the ATFL and the CFL first. So those ligaments are typically damaged when you have a lateral ankle sprain or an inversion ankle sprain. The tests that you're going to look at are anterior drawer and medial talar tilt. These tests are administered with a similar hand placement, but you're really focused on the direction of force that is applied to the calcaneus. The positive finding for these special tests are excessive translation of the talus compared to the other side. Next, the deltoid ligament. So it is a combination of ligaments that we just know as the deltoid ligament. You can see in the picture how big that group of ligaments are, and it's on that medial side of the ankle. So medial ankle sprains are typically due to eversion of the ankle, and therefore the special test will be a lateral talar tilt where you are just administering medial to lateral force to the calcaneus into eversion, basically replicating the way that they injured the ankle. And the positive finding would be increased translation compared to the contralateral side. Next, syndesmosis. So syndesmosis is between the tibia and fibula, and there's also this ATFL, which is the anterior inferior tibiofibular ligament. Syndesmosis sprain is also called a high ankle sprain. It is typically due to full dorsiflexion with external rotation, which shoves the talus between the tibia and fibula and causes that strain. The special test to assess the syndesmosis is a squeeze test. You will start more proximal on the leg, and you will work your way down, squeezing the fibula and tibia together. This can be performed in short sitting as well, in addition to this picture of administering the test. The higher the pain above the malleoli is indicative of a more severe injury. So nerve testing, there's two that we're going to look at today. Tunnel sign for tarsal tunnel. You're going to percuss on the tarsal tunnel, which is posterior to the medial malleoli. The other test is the Morton squeeze test, which looks for neuromas, and it's typically that when you squeeze the forefoot, they will have a reproduction of pain or paresthesia into the forefoot, and that would be that positive test. Other tests for the ankle, you have the Thompson test, not to be confused with the Thomas test, which is an iliopsoas muscle link test, but Thompson test is to test for the integrity of the Achilles tendon. So what you will do is you will squeeze the gastroc and you will see if the foot plantar flexes. If the foot fails to plantar flex when squeezed, that would indicate rupture of the Achilles tendon. Ankle impingement test. You're just seeing if the ankle is impinged. You would do that through a forced dorsiflexion test, and they will have reproduction of pain at the anterior lateral aspect of the foot or ankle during that forced dorsiflexion. Lastly, to look for plantar fasciitis, you would do a windlass test, and basically what you do for this test is extend the great toe, and you should see a rise in the arch of the foot. If they have pain along the medial longitudinal arch with great toe movement, that will be a positive test for plantar fasciitis. Practice question. A patient demonstrates a clinical presentation of a high ankle sprain. Which of the following tests would confirm this diagnosis? A. Anterior drawer test. B. Windlass test. C. Squeeze test. D. Morton's squeeze test. I'll give you a few minutes to look this over. Pause this if you are not done answering the question we're about to review. So what is a high ankle sprain? So I mentioned before that a high ankle sprain is a syndesmosis sprain, which occurs with full dorsiflexion and external rotation. So let's go through the answers. Anterior jaw test is for ATFL and CFL, and that is for an inversion ankle sprain, so that's not what the question is asking. Windlass test is for plantar fasciitis. Squeeze test, that is for high ankle sprain. And then Morton's squeeze test, this was kind of a distractor answer because it does say squeeze test, or it has squeeze in the name, but the Morton squeeze test, remember, is for assessing for Morton's neuroma. You'll be squeezing the forefoot, not necessarily the tibia and the fibula, to assess for high ankle sprain. So C is the correct answer. Squeeze test, that is looking for a high ankle sprain. Morton's squeeze test is a little different because that's looking for Morton's neuroma. So here we have a summary on the ankle special test. It's going through all the special tests we talked through today, why you would do these tests, and then what would a positive test be. Be sure to check the description for a link to lower quarter special tests, and it will have, like this chart, the indication and a positive test, but it will also tell you how to administer all these tests with pictures similar to this PowerPoint. Thanks so much for watching. Be sure to like us on YouTube, subscribe to our channel, and turn on the notifications. Check out these other videos. We'll see you next time on Journey to 600.